There's a question that medicine avoids asking directly, and it's not, can we keep you alive? The uncomfortable question is, what does it mean to keep someone alive? It seems obvious, but survival and living are not the same thing. Perhaps this is uncontroversial, perhaps this is something we can agree on. The whole idea of assisted dying forces medicine to confront something rather uncomfortable. That sometimes extending life extends suffering, and that not all suffering can be fixed. So the way I see it, the real question isn't whether assisted dying is moral or ethical, it's whether medicine is ethically coherent without it, and that's the case I'd like to bring forward today. My views in this video don't represent a person or any organisation, these views are my own, and as a medical student myself, I don't have all the answers, but I am learning how to ask the right questions. And assisted dying sits right at the heart, at the intersection of medicine, philosophy, identity and fear. So I'd like to talk about it properly. I'd like to start with my philosophical argument that human beings don't really live in the present. Not in the way we like to pretend we do, not in the way we think. We live in the future that we imagine. What I mean by that is every decision you make is aimed at a version of yourself that doesn't yet exist. The exam that you revise for, the person you give lots of love to, the job that you're actively working toward, the person you plan to become 5, 10, 15 years down the line. Your identity isn't just built from memory, it's built from intention. You're not only what you know, and you're not only what you were, you are who you're trying to be, your plans, your hopes and dreams. And that's why terminal illness is so incredibly and uniquely devastating. Because it doesn't just attack the body. I'm talking about incurable cancers, motor neuron disease, intractable painful illnesses. These things don't just bring pain or weakness or loss of function, it collapses entire futures. These diseases that are incurable take the imagined life you are orienting yourself towards and it removes it. Suddenly the milestones that you had disappear. The long-term goals that you were building yourself towards, they all dissolve, and the quiet assumption about one day no longer exists. When the future disappears for a person in their head, something fundamental breaks, and that is what I call the future self-collapse. I like to think of it as a psychological and existential trauma of watching the person you are meant to be evaporate in real time. You're not just suffering physically, you're grieving a life that will never happen. Your own life. The parent you won't become, the friend you can never be, the career you won't finish, the ordinary, boring life that you've always wanted, or an exciting one. And what's so cruel is that this grief doesn't come all at once. It happens daily, in conversations, in calendar dates that suddenly mean absolutely nothing. Feel it in the plans that people make around you rather than with you. It is my firm belief that when medicine can no longer restore the body, it also struggles to acknowledge this loss of identity. This is because we're trained to treat pain, not the collapse of meaning and being. And this is where the question of assisted dying becomes unavoidable, because at a certain point the debate isn't just about prolonging life, it's about whether you're okay with forcing someone to exist without a future, whether you still think this is care, or whether you think this becomes a form of quiet cruelty. I think medicine is very good at measuring pain. We can score it out of 10, we can chart it, we can treat it as well. But suffering isn't pain, not in the philosophical sense. Pain is a signal from the body, it's a stimulus, but suffering is an experience of the self, it's an individual subjective experience. And I believe that suffering begins when your illness starts taking things away from you. Not just your strength, but your control over your body, control over your time, control over your choices. And then comes the loss of dignity, being washed away by others when you're washed yourself, being spoken about instead of spoken to, becoming a task on a ward round rather than a person with a life and intention. And beneath all of these things, most importantly, I think something even deeper starts to erode, and that's meaning. That's something that gives life purpose. Life starts to lose its meaning when your days are no longer oriented towards anything ahead, when treatment becomes maintenance rather than hope, when surviving replaces living. And finally, the most inevitable loss of all, ownership and authorship of your own life. When you're dependent due to an incurable illness that leaves you profoundly disabled, profoundly unwell, decisions are made for you. Plans are rewritten around you. A future is managed by protocols instead of chosen by you. Two patients can have the exact same diagnosis, the same prognosis, the same scan as well, but their subjective experience may be completely different in terms of suffering. Because suffering is subjective, and on a philosophical level, I think this is what the case for assisted dying truly comes to. It depends on values, it depends on identity, it depends on what makes life worth living. And yet in healthcare, we always wrongly assume that suffering can be standardized, as if a score, some sort of a guideline or a pathway, can fully capture what it truly means to lose yourself slowly. We can't understand these things. We treat our bodies as though they are interchangeable, but our lives aren't. And I think that when medicine only treats pain without recognizing suffering, it risks keeping people alive whilst quietly stripping away the reasons they wanted to live at all. Medicine, individual autonomy is sacred. It's one of the first and most important core principles we're taught at the very beginning of medical school. This isn't taught as an optional extra, it's the foundation of ethical care and how we treat patients. You see, as a competent patient, you're allowed to refuse chemotherapy. You're allowed to refuse ventilation. You're allowed to refuse life-saving surgery, dialysis, any life-saving treatment, and we respect these decisions under autonomy. Even when refusing these things guarantees death, we already accept that a patient can choose death indirectly by saying no, simply by refusing, through withdrawing consent and allowing nature of the disease to take its course. And we don't call that suicide. We call it respecting autonomy. So here's the uncomfortable truth. If autonomy allows a patient to refuse treatment and die slowly, sometimes in a lot of pain, sometimes in fear, often over weeks or months, but doesn't allow that same patient to choose a controlled, deliberate death, decision made with dignity, then autonomy isn't really autonomy. That's something we have to rethink. It sounds more like conditional permission. It's conditional permission that says you may choose how long you suffer, but not how you die or end that suffering, which to me is unacceptable. You may refuse intervention, but you may not actively decide when your life ends. And this distinction feels very neat on paper between choosing your death and withdrawing treatment, but ethically it's deeply inconsistent because the outcome is the same. If we look at consequentialism, that the morality of an action is contingent on its consequence, then the outcome is the same. Death, your patient will die. The intention is the same as well, whether it be withdrawing treatment or allowing a patient to take charge of their mortality. The consequence is death, and the difference is only the level of suffering we are willing to tolerate. When we respect refusal, but forbid choice, we're not protecting life. We're not promoting life either. We're protecting ourselves from our own discomfort. And this raises a serious ethical question, which I think you should ask yourself. Are we truly respecting patient autonomy, or are we enforcing it in a version of death that feels more acceptable to us, whilst pretending it's actually something neutral? People often say doctors must do no harm, and this seems very sensible to me. It sounds absolute. It sounds clarifying, comforting, even sounds moral. It sounds reasonable, like I said earlier, but medicine has never actually been harm-free. We amputate limbs, we give toxic chemotherapy, we break ribs during CPR, we sedate patients, knowing it may hasten death. And you're probably thinking, well, all of these things are for the patient's benefit. And that's exactly the point. These are not side effects we're unaware of. These are harms we accept intentionally. So why do we accept these harms? Well, medicine doesn't actually operate on harm avoidance. It operates on harm justification. We accept harm when it reduces overall suffering. And that's the same ethical logic we already use, whether we name it or not. It's consequentialist. We judge actions not by what they are, but what they lead to. The intent by which you do something matters. The outcome of it matters. The balance of suffering that you make matters as well. When we give chemotherapy, we're not denying the harm. We're saying that the harm is justified by the relief it may bring. So the real ethical question isn't, does assisted dying cause harm? Of course it does. Death is an irreversible process. It's uncomfortable to talk about. There is absolutely no denying it. But the real question is forcing someone to endure unavoidable, irreversible, excruciating suffering also a form of harm? If both of these paths cause harm, which harm is greater? A controlled death chosen by the patient, or a prolonged dying process imposed by policy, imposed by fear, imposed by moral dissent or discomfort? When we refuse to consider assisted dying on the grounds of do no harm, we're not choosing no harm. We're choosing a different kind of harm, one that lasts longer, one that erodes dignity and strips away control. And using consequentialism, I guess it forces us to face something uncomfortable. Sometimes preventing an action doesn't prevent suffering, it simply guarantees more of it, which is especially true in the case of assisted dying and people with intractable chronic illnesses. As a medical student on the wards, I've met patients with motor neuron disease and terminal cancer diagnoses. It's painful. I mean, I remember them and it makes me sad. There is only so much medicine and medical therapy can do. The overarching ultimate goal of medicine is to sustain and prolong life. But when that's not possible, our goal should be to alleviate suffering and empower and honour a patient's right to do so in the appropriate circumstances. Now, the medicalisation of dying is a section in this video that frankly deserves its own video entirely. It's still worth speaking about here, so here's the irony. We have medicalised death so completely that dying itself has come to feel like a failure. You see, when a patient dies, it is seen as a failure of treatment. It's seen as a failure of effort, seen as a failure of hope. And whilst in some cases these things are appropriate, it pushes us to do better for our patients, we still have come to see death as something we must delay. Something that we need to fight, something almost shameful. You see, in hospitals, I feel like death is something that happens despite us. It's not something we are trained to acknowledge openly. You see, charts fill up, treatments escalate, and conversations become quieter surrounding death. They become shorter and more evasive. Because once we name death, we fear we are giving up almost. But death is not a medical error. It is not always a complication. It's not always a medical failure or a sign that someone didn't try hard enough. Death is a biological certainty, something that we don't think about every single day, and we shouldn't, fair enough. And although this will sound controversial, when medicine refuses to acknowledge this simple fact, patients are the ones who pay the price. You see, by holding this viewpoint, patients are kept in a limbo. They're not truly living, and they're not allowed to die well either. A patient's final months becomes dominated by interventions rather than meaning, by constant monitoring rather than memory, and it becomes more about survival rather than closure with dignity. And the tragedy is that medicine is at its best when it knows its limits. And I think medicine truly works best when its aim shifts from prolonging life at any cost to preserving dignity and comfort at the end of it. Because when death is treated only as an enemy, patients lose the chance to prepare, to say goodbye and make sense of what their life has been. It deprives them of dying on their own terms. It deprives them of closure. And I think that a system that can keep the heart beating but cannot help someone die with dignity is not morally neutral. It is making a choice. And until we confront the medicalisation of dying, we will continue to confuse the extension of biological existence with the preservation of human life. There are some strong arguments that I'd like to talk a little bit about in this video against assisted dying. And I think the strongest argument against assisted dying is what about vulnerable people? People who feel like a burden, like the elderly, people with disabilities, people with depression, people who might feel pressured into taking their own lives, whether this is subtly or overtly. The elderly, I mentioned, for example, into choosing death, and that concern is real. Those concerns are valid. These are concerns that deserve to be taken seriously. But here's the mistake we often make. We assume that banning assisted dying protects the vulnerable, but it doesn't. All it really does is protect the system from responsibility, which I understand is an important consideration, but suffering does not disappear when the law forbids choice. It simply becomes hidden, swept away. It sort of moves behind closed doors. People will still keep dying, and they will die without control, without any transparency or oversight. You know, some people will die slowly in institutions that were never designed for meaning, and some people will die earlier than expected. and some people will take matters into their own hands. It happens. Alone, frightened, and unregulated. Very dangerous for a patient. I think prohibition of assisted dying wouldn't eliminate risks. It just ensures that the risk is unmanaged. Ethical policy isn't about pretending danger doesn't exist. I completely understand that. It's about acknowledging that it does and building safety systems to contain it. You see, that's what safeguards are for. Capacity assessments to ensure decisions are informed and stable. There should be independent medical reviews to prevent coercion or error. There should be mandatory time delays to separate impulse from a well-rationalized resolve. These are sensible things. And there should also be a strict eligibility criteria to limit access to some clearly defined circumstances. And these things aren't loopholes, they're ethical guidelines designed to protect people. It strengthens the argument because the alternative to regulated choice is not safety, it's abandonment. If we truly care about vulnerable people like the elderly, which I think is a very strong argument, we don't remove their agency in the name of protection. Instead, it makes a lot more sense to build systems that are careful, transparent, accountable, and brave enough to engage with suffering instead of looking away from it. I think that language really matters because words shape our moral instincts. Our words decide what feels compassionate and what feels dangerous before any argument is even made. What I'm talking about is the idea of assisted suicide. It might sound minor, but a lot of people use the term assisted suicide. The terminology to be fair, is dying out. But then I think it's problematic. Euthanasia, assisted suicide, that's not what this is. These things are framed as a despair. And I want to challenge these notions of assisted suicide or euthanasia because they simply aren't accurate. When you call assisted dying a person's willful desire to take their own lives due to an incurable illness, and you label it as suicide or euthanasia, it's considered impulsive. It's something that people consider as being pathological. We think it's driven by mental illness or a sense of hopelessness. You see, suicide is a language we associate with prevention, with crisis lines, with intervention at all costs. And when we use that word, when we use the word suicide, we import all of these assumptions about it into the debate, which I think is inappropriate. But assisted dying tells a very different story. It frames the act not as a failure of the individual's will, but as an act of care at the end of life. Assisted dying is an appropriate term because it recognizes deliberation rather than impulse, capacity rather than an acute crisis, and it upholds dignity rather than considering this thing a pathology. A person suffering from an intractable disease is not suicidal. They just want to stop hurting and suffering. And to me, that's so painfully human. You see, the term suicide assumes something has gone wrong with the mind, and assisted dying accepts that something irreversible has gone wrong with the body. And it's that difference that really matters, because language doesn't just describe reality, it organizes our moral response to it, which I think is very important. It tells us who is vulnerable, who is responsible, and who deserves compassion. This isn't semantics, it's just moral framing. And if we get the language wrong, we end up debating the wrong problem. So here's my philosophical synthesis, if you may. This is my final position, not as a slogan or a provocation, but sort of as an overarching conclusion from everything we've talked about. Assisted dying is ethical when suffering is subjectively unbearable. Not because pain can't be treated, which is true, to a great extent it can't, but because suffering isn't reducible to pain scores of protocols. When life has become an experience the person themselves finds intolerable. It's when the future self has collapsed. When there is no longer a coherent version of the person they are living towards, no meaningful horizon, no remaining narrative that still feels like it's theirs. But when autonomy is intact, when the person understands their condition, they understand their options, they've weighed these things up and the consequences of doing these things, and they still continue to choose consistently and without coercion. And when medicine has no remaining curative role, not when a cure is unlikely, but when it is no longer possible, when treatment has become more of a maintenance, when intervention becomes postponement, because at that point medical's ethical duty shifts from prolonging life to protecting meaning, from maximizing biological survival to protecting the individual person's dignity, from fighting death at all costs to honoring the person who is dying rather than death itself. It's about recognizing that there are moments when continuing to treat the body whilst ignoring the collapse of the individual self is no longer care. I think that medicine that refuses to acknowledge this risks preserving existence whilst erasing personhood. And if medicine is to remain a moral profession, not just a technical one, it must be willing to accompany people not only in living longer, but in dying well. And I'm not just talking about assisted dying, I'm talking about dying well. The over-medicalisation of death is a problem, and it's something I'd love to talk about in a lot more detail in a future video. Well, it's never a philosophical Ashmit video if I don't talk about memento mori, an important old philosophical reminder that I love to talk about. Memento mori, remember you will die. It was never meant to be morbid. It was never meant to be clarifying, to strip away illusions of permanence, to remind us that time is finite and therefore precious. And there's also a second reminder that I love to talk about. Memento mori. Remember you must love. Remember that what makes life meaningful, care, dignity and compassion are not luxuries. They are the whole point of life. Assisted dying is not about choosing death. Death is already coming, no matter what. It is about choosing how much suffering love should tolerate. It's about asking whether extending life at all costs can sometimes betray the very values that made life worth living in the first place. Medicine is extraordinary in delaying death. I've no doubt about that, but it is not always good at knowing when to stop. And sometimes the most humane and appropriate thing medicine can do is not another intervention, not another escalation, not another day survived on a ventilator in the ICU at the expense of selfhood. Sometimes the most compassionate act is to recognize that the fight is over, not because the patient has given up, but because they have already given everything. I mean, the kind of doctor I'd like to be, I'd sit with them, I'd listen, I'd honour who they were, I'd listen to their life stories, I'd allow them something profoundly human, permission to rest. Death is inevitable, but suffering doesn't have to be. If you'd like me to make a long, comprehensive video examining and breaking down the current UK bill being considered for assisted dying, dissect every single argument both for and against it from a slightly less philosophical angle, let me know. I think I found a very interesting niche here on YouTube looking at medical ethics and philosophy. I've got several interesting videos planned, many of which I'm about to record right after this one, and I'd love to get some feedback. But until then, goodbye, Merry Christmas, and I'll see you in the next video.